I'm directing my team to work with Pfizer to double our order from 10 million to 20 million treatment courses on testing. I know this remains frustrating. Believe me, it's frustrating to me. But we're making improvements. In the last 2 weeks, we've stood up federal testing sites all over the country.
President Biden yesterday trying to ease anxiety over the pandemic as the U.S. shatters the global single-day record this week with more than 1 million new cases reported Monday. The fast spread of infections is creating chaos for air travel and leading to hours-long wait times for testing. Let's bring in Admiral Brett Giroir. He is a former White House coronavirus task force member, and you are the testing czar. I want you to listen to the back and forth with the White House yesterday. This is Jen Psaki closes this out, but this is what they said they were going to do on testing and where she says we are today. Watch. We don't have it. All right. Basically, she says this. The first delivery from manufacturers will start later this month, and obviously then we will work to get it out the door as quickly as possible. This is in regards to the fact that they said right before Christmas they would get 500 million tests out to Americans. But, Admiral, by the time they get those tests to Americans, it is likely that the Omicron surge will be likely behind us at that point.
Yes, you're exactly correct. I think the problem we have right now is there was a lack of federal orders for tests between January and September. So as we saw, the industry really cratered, the manufacturing lines were taken down, the people were laid off, and now we're really behind the 8 ball. But we are where we are right now. You are correct, that 500 million tests, if you look at the government's RFP, that's going to be over 3 months. So that's really a drop in the bucket. So what we really need to do now is use those tests smartly, and I see no indication that the administration is doing that. You talked about isolation. Everyone who tests positive, you could send them one of those tests so they could test at day 5. We should be sending it to the elderly and those with comorbid conditions so that they could test early and get the Pfizer or the Merck drug. But we're seeing no indication of leadership. We're just seeing more confusing guidelines from the CDC.
It really is shocking. And the CDC is the Centers for Disease Control. You need the public to be able to trust them. And then the president said this again yesterday. It's call for 2. This is where he said something he said hundreds of times before. I took exception to it. Watch here.
There's no excuse for anyone being unvaccinated. This continues to be a pandemic of the unvaccinated. So we got to make more progress. And for patients who still haven't gotten your kids vaccinated, please get them vaccinated.
Does that still hold water? I mean, I have double vax, booster, and I had my flu shot, and I spent Christmas week sicker than I've been in decades. So, and I'm dating myself a little bit there, but I really am glad that I have the vaccines. I know it kept me out of the hospital or even possible death. But this is not just about the unvaccinated anymore if everybody can spread it.
You're exactly right. I want everybody to know that getting vaccinated, and particularly with Omicron, getting a booster is very important to your protection, especially if you're elderly or high risk. But you are correct, because Omicron circumvents immunity, both vaccine and natural immunity. People in the hospital, now they won't tell you the figures, but I'm sure that a majority of the people in the hospital have at least been vaccinated doubly. And we all know people who've gotten the booster and are still getting Omicron. So I think it's a disservice to say it's just by the unvaccinated, because it's telling the vaccinated that you don't have a problem, you're not subject to Omicron, and that's false. So it's not only incorrect information, I think it's doing a disservice to public health by blaming it on the unvaccinated people. This is a problem we all have to face, vaccinated, unvaccinated. We need to get our booster. We need to have plans that if we do get sick, particularly in a high-risk group, that we can get antibodies or we can get those oral antiviral therapies.
But it's one of those things where the government needs to step up, but what you're saying here is that we see no signs of that. No urgency and old language being recycled.
I mean, look at the CDC new recommendation. After 5 days, if you could find a test and if you want one, then go take an antigen test. That's not a recommendation. How about you'd say, well, if you could find a vaccine and you want to take one, take one. No, make a recommendation. And the recommendation should be that after 5 days, if you are going to be in a high-risk situation, if you're a food server, if you work in hospitals, if you are going to be around a lot of people, you should take a test before you leave the home. In the United Kingdom, it's 7 days of isolation followed by 2 sequential antigen tests. that makes sense. But when we're having 1 million cases, and remember, that 1 million cases is probably underestimated by 3. We're having 3 million new cases a day. We have to be cautious, and taking a test to get out of isolation seems incredibly reasonable, and the government can fix this. Send tests to the people who are positive. State and local health departments know who they are.
Right. Well, you must, as the former testing czar, it must frustrate you to see all of these lines. We have pictures from all over the country, people standing in line for hours to try to get a test. Admiral Brett Giroir, thank you. We'll stay in touch.